Good morning, everyone. Thank you all for joining. I know it's going to take a few minutes for everyone to arrive. So as chair, my task is to let that happen. And while it's happening, I'll give you a brief introduction to the event and our speakers. My name is Charlie Weinberg. I am the chair of the Centre for Crime and Justice Studies. And I'm delighted to welcome you all here today. Most of you will know the Centre for Crime and Justice Studies is an organisation responsible for informing and educating the public around issues of crime and justice. We're delighted to be able to do that on the scale that we do, and I can tell you that 525 people registered for this event, so clearly there is a huge international interest in the area we're about to spend an hour and a half talking about. Alongside my role at the Centre for Crime and Justice Studies, I work in an organisation, a service delivery organisation, running programmes in prisons across England and Wales, which we haven't been able to do since February, like many of you, I suspect. However, I can also say that we are in contact with staff and family members of people in prison, all of whom obviously have huge issues, challenges, vital experiences and voices that very rarely get heard. We know that in the UK, in England and Wales, the prison service has been under command and control since March, which is an unusual event and has huge impact for individual establishments, the staff and of course the people in prison and their families. And very shortly I'm going to introduce your four speakers one by one, each of whom will take 10 minutes to talk through some of the detail of some of those perspectives from their own jurisdiction. This is the first of 4 seminars we'll be running, and this one, particularly looking at prison populations around the European jurisdictions, was born out of a survey that the CCJS ran with colleagues in the European Prison Observatory starting in March. Some of the data that came out of that survey was interesting, but we felt required a bit more attention. And so that's what we're aiming to give it through this event. Please use the Q&A function. Please, if you have comments, if you have questions, put them in Q&A. Don't put them in chat. Use Q&A. If you think someone else has asked a really interesting question, press the thumbs up and that will bump it up the list. We've got 200 people in attendance already, so it will be really helpful for the production team if you can raise up the questions or the comments that you think are most interesting and pertinent for colleagues. During the open discussion at the end, we will be offering people opportunities to come on through audio and ask their own questions. So you might get a message from one of the production team asking if you'd like to do that. Feel free to say yes or no. It's an open invitation. We want to generate conversation and discussion with the colleagues here today. We know that there are people from all around the world, so I think there's going to be some really useful, insightful and varied perspectives to share. In that case, it is with pleasure that I can introduce to you our first speaker for the day, Matt Ford. Matt is a research analyst even, at the Centre for Crime and Justice Studies, and is going to be talking about prison population and management in England and Wales. Matt, thanks.
Thanks, Charlie, and thanks everyone for joining us today. I'm excited to hear from other speakers about what's going on in their jurisdictions to see what we can learn. In terms of what I'm going to talk about what happened to the prison population in England and Wales during the period of the first lockdown. Then I'll talk about the implications going forward. And to frame this, prison populations are subject to a number of dynamic factors, and I'm going to talk about these in a data-led way, highlighting key developments to explain the trends. I'll cover the best available and most current data, focusing on how things changed between the periods January to March and April to June this year, or the first 2 quarters of 2020. This is an abridged version of a comment piece that I'll publish on our site if you want to get more detail. You might see my comment piece I did in June, which was on this subject, but speculative because the data wasn't available at that point. We'll also post my slides on the site afterwards as well. And before I go into the deep dive, the key takeaway here is that the prison population in England and Wales dropped due to the routine release of prisoners not being matched by the number entering prison because the courts were processing fewer cases. Okay, so how did the prison population change in England and Wales? So before the lockdown was imposed at the end of March, it stood at 84,000 people in prisons. And by the end of June, it stood at 79,500. So that's a 5% drop that we saw. So what factors have impacted these changes? If we start with the entry point to the criminal justice system, police recorded crime fell 15% in this period. And on the 14th of April, the Crown Prosecution Service issued guidance asking prosecutors to prioritise the most serious cases, including COVID-related cases, and to consider the impact on the criminal justice system when assessing whether a prosecution was in the public interest. The CPS have indicated that the ability to make charging decisions hasn't been hampered as they moved to remote working in this period, like so many of us did. So if we look at the use of remand, so there were 18% more untried prisoners and 1% more convicted unsentenced prisoners in June 2020 compared to February. And this reflects the fact that the CPS guidance prioritised more serious cases where remand is more likely, that courts were prioritising remand hearings, and a slowdown in court activity, which I'll talk about in a moment. And the government actually extended custody time limits, or the amount of time a defendant is allowed to spend imprisoned awaiting trial, from 6 to 8 months in September, reflecting the slowdown in the courts, meaning defendants were being processed more slowly. So if we talk about court activity and sentencing trends, COVID restrictions had a very big impact on the ability of courts to carry out their business. So in March, almost half of all courts were closed. The move to digitisation accelerated, with up to 90% of hearings carried out remotely, although hearings were still down significantly. Jury trials were particularly affected because obviously you need quite a lot of people in the room at the same time, but due to social distancing, that wasn't possible in many instances. So for about 4 weeks from the end of March, no magistrates' court trials took place. And in the Crown Courts, all jury trials were suspended on the 23rd of March and only began to resume in the week beginning 8th of May, but at significantly reduced levels. If we look at how that played out in the data, we can see that the number of criminal cases coming into the magistrates' courts fell 37% in this period, caused by the drop in recorded law breaking. Disposals in the magistrates' courts, however, fell 59%. So this meant that outstanding cases in the magistrates' courts rose 30%. If we look at the Crown Courts, the number of criminal cases coming into the Crown Court fell 45% and disposals 47%, leading to an increase in the backlog of 5%. If we look at trials specifically, effective trials in the magistrates' courts fell 92% in this period and 97% in the Crown Court, with a massive increase in the number of vacated trials, which are where they're listed, but they have to be abandoned. Okay, so now if we look at actual disposals handing out in the court, sentences of immediate custody dropped 36%, which was actually the smallest drop of any sentence. And that reflects the fact that the CPS guidance recommended prioritising the most serious cases, which are more likely to receive a prison sentence. I should also point out that the Lord Chief Justice said on the 1st of May that the current conditions in prison represent a factor which can be taken into account when deciding whether to suspend a sentence, as the impact of a prison sentence is likely to be much greater in the current context. So if we look at how those sentencing trends feed into the actual prison population, there were 51% fewer sentence first receptions to prison in this period. So they basically halved. Look at how that translates into the actual daily population of sentenced prisoners. There are around 67,500 sentenced prisoners in June 2020, compared to nearly 72,750 in February. So that's a drop of 7%. The increase in the remand population offset, that I talked about at the start, offset some of the decrease in the sentenced population. Okay, then if we look at the flows out of the prison system, in terms of normal releases of people on determinate and indeterminate sentences, there were 10% fewer releases from prisons in this period. So about 90% of releases that would have occurred. So not much impact on the number of people going out, but a far reduced number of people going into prison. So that's why we saw the change in the prison population. And I'll just talk briefly about discretionary releases. So despite an announcement that up to 4,000 prisoners could be released early under temporary schemes, COVID-related schemes, only 316 have so far been released, and that was actually paused in August. So just to summarise this section about the dynamics of the prison population, the main factors pulling the prison population down in England and Wales were the combination of drops in crime, the suspension of court activity for a time and diminished capacity thereafter, and the normal release of prisoners at the end of their sentences. Okay, so what are the implications for controlling future outbreaks in prison of the virus? I think it's important to outline the approach that was actually taken to managing the virus in prisons, since a significant reduction in the prison population wasn't really part of that strategy. The prison service opted for a highly restricted regime and compartmentalisation of the custodial estate. Compartmentalisation involved reducing inter-prison transfers, setting up isolation units for known or probable cases, setting up shielding units for those most vulnerable, and setting up quarantine units for new receptions or transfers. They also installed 1,200 temporary units and reopened a wing of a closed children's prison. So that's Medway Secure Training Centre. If we look at the impacts on cases and deaths among prisoners, we've so far seen 1,500 confirmed cases and 32 deaths of prisoners up to October. In the initial phase, prisoner cases decreased before staff cases, suggesting the strategy may have been effective. And then restrictions in prisons began to be slightly eased over the summer into autumn after about 4 months of extreme lockdown. However, we then saw a massive resurgence in October with 900% more cases in prisons than in September and 5 additional prisoner deaths. And all symptomatic cases have been tested since mid-April, so these trends are likely to be quite reliable, although, as in the general population, there'll be a significant proportion of asymptomatic prisoners who aren't in the statistics. What these figures indicate is that without a more significant reduction in the prison population, it is difficult to implement a more normal regime without risking further outbreaks. And there are other risks associated with very restrictive regimes, such as impacts on prisoners' mental and physical health and disruption to any programs they're engaged in. Okay, so what are the implications for future reforms aimed at reducing the numbers in custody? So for England and Wales, it's difficult to draw any lessons in terms of practical reforms, since there were no reforms introduced to attempt to reduce the prison population. So instead, I'll talk about some issues on the horizon which have implications for the size of the prison population and the capacity of the custodial estate. So the backlog in the courts has to be cleared, and there are plans to increase police officer numbers by 20,000. The spending review earlier this month pledged hundreds of millions of pounds in investment in courts to help them clear that backlog, as well as deal with the impacts of 20,000 more police officers. These are likely to feed back into the prison system. The spending review also announced billions more to build 18,000 new prison places, which is nearly double the number of new places previously announced. And the government have already indicated that they were looking to get more use out of the temporary accommodation units they installed, so they are not single use. We should be very clear they should not become more permanent capacity, especially as the new prisons being built aren't due to come on stream in the short term. And we should also watch out for how the government may continue to sell us prison building as a way to kickstart the economy after COVID. So given that it looks like we're entering a new phase of criminal justice expansion, I think we should be using this time to think more radically about how we can reduce the size and scope of criminal justice, including taking capacity out of the prison system and exploring solutions which lie outside of criminal justice. Because coming out of COVID, these kinds of social issues may become more contested in wider society. So that's all I have to say. I'm eager to hear other people's thoughts and reflections on this, as well as the contributions from other countries where far more was tried to reduce the prison population. And I'm interested to hear from the audience if other countries have taken different approaches in the second wave, and if anything was learned from the first wave, which is being taken forward in the second. So thanks for that, and back to you, Charlie.
Thanks, Matt. That has provoked, as expected, quite a bit of interest in the Q&A. I know John Samuels has posted a link to an article he has published in the Times this morning. People might want to look at that, calling for people to be released. And Barry Snellgrove has a question which you might want to answer now, but I'm also happy if you want to think about it and bring it back at the end, about the proportion of women that have been released as a result of everything you've just presented. And a question from Eva Dawidziuk from Poland, who's talking about pre-trial detainees access to, I'm not sure if Eva was talking about Skype court procedural justice by Skype, but certainly family contact. So I wonder if we hold that question for the end, unless you want to say something now and bring it back, because I think everybody is going to, from their different jurisdictions, want to respond.
Definitely. Thanks for that, Charlie. Okay, so I'll try and answer that question first. I get quite anxious and like flustered and my brain freezes, so I'll just try to like give you the correct information. So in terms of the discretionary releases of about 316 people, I don't know exactly how many were women. There were, I think, one of the schemes was to release pregnant women from prison early on temporary release because they were a high-risk group. I think there was about 70 in prison, but only 21 were released in the end. And again, I don't know how many of the normal releases, so the normal releases obviously reduced by half, the normal releases, about 90% went ahead, that would have gone ahead anyway. Again, I'm not sure what proportion, but because the women's prison population is, there's a much higher proportion of people on short sentences than there is in the men's population. I would imagine it's quite a high proportion. I know that the women's prison population dropped by, I think, about 21%, which is more than the general population. But I can put the actual accurate figures into the comment piece that I publish after, so you can get a very definitive answer for that.
And I think, Matt, there's probably going to be quite a few colleagues in the audience who will have some really up-to-date and interesting information that they can share about that question. Cecile Marcel, unexpectedly now, is going to present. Cecile was the director at the Observatoire International des Prisons, and we are delighted that she's going to give us a perspective from France. Cecile, thank you.
Yes, good morning. Can you hear me? So I'll try to share my screen. I hope it works. If it doesn't, does it?
Yes.
Okay. So, sorry, just a minute. So I'm going to talk about the situation in France as regards prison population before and after the sanitary crisis. I wanted to start with a few words of introduction regarding the situation that French prisons were facing before the crisis. Indeed, you have to know that France was facing severe prison overcrowding before the outbreak of the crisis. I've put a graph here with lots of little information you can't read because it's too small, but it doesn't matter because it's in French. The important thing is the yellow line, which shows the growth of the prison population between 1990 and 2020. And you can see that it has been steadily growing, starting from 40,000 inmates in 1990, reaching over 72,000 inmates in March 2020. So obviously this led to important overcrowding, and it also led to the conviction of France by the European Court of Human Rights in January 2020, so at the very eve of the health crisis. This conviction regarded 27 cases of inmates that had brought their case before the court regarding 6 prisons. The court decided that these persons were subjected to inhuman and degrading treatment regarding their prison conditions, but most importantly, the court pointed out that this situation was the result of structural problems and that these structural problems needed general measures to be taken by France. So the court made general recommendations to France to put an immediate end to prison overcrowding and to improve its prison conditions. I'm trying to, sorry. So obviously when the crisis broke out in March 2020, it was obvious to everyone working with the prison system that French prisons were not in a position to face the epidemic. There was no possibility to respect social distancing with sometimes 2 or 3, even 4 persons sharing the same cell. There were very deteriorated infrastructures, deficient sanitary conditions, and above all, the health units were suffering from a chronic lack of means and staff, which made it impossible for them to face important number of sick persons. Despite this situation, the Minister of Justice, who gave an interview to the press on the 17th of March, said, "This is not at all in our plans to take early release measures." But in the few days that followed, there was a huge mobilization of all justice sector actors, magistrates, lawyers, prison staff directors, human rights organizations, official institutions, all spoke out to say there was an urgency to take early release measures and to reduce the prison population, because it was the only way for French prisons, to face this situation. So eventually the government stood back and announced that it was planning to reduce the pressure on prisons. On the 25th of March, then, it issued an order with a number of measures to be taken. Sorry, I've gone too far. So there were 3 main measures in this order. The first one, which was the most important one, was home detention for convicts having less than 2 months to serve. There were, however, conditions to access this measure. Firstly, you had to serve a sentence not exceeding 5 years imprisonment. And secondly, you had to not have been convicted for a crime, a terrorist offense, domestic violence, or child abuse. Obviously, these conditions were meant to make it acceptable to the general public. The second main measure was the possibility to grant exceptional reduction of sentence for up to 2 months. These applied to the same persons as before, but with an additional condition, which was that you had to have a good behavior during the sanitary crisis and lockdown period. Basically, what this means is that this measure was not meant to be applied now, but only after a kind of probation period. So you can see it's a kind of carrot and stick measure to ensure that there would not be any protest during the lockdown period in the prisons, as could have happened in Italy, for example. The third measure was the possibility to convert the remainder of a prison sentence up to 6 months into a non-custodial sentence, which was mainly electronic monitoring. There were some criticism of these provisions by civil society organizations. I won't go into details because I might lack time. The main thing maybe I want to underline is the main concern regarding remand detention. In France, persons awaiting trial account for 30% of the prison population, so it is an important proportion. However, there was no provision to favor the release of prisoners awaiting trial, and even worse, the government provided for measures that planned the automatic reconduction of all pre-trial detention orders without any debate. So this measure triggered huge debate among the professions, and lawyers contested it in front of the court, and it was eventually repealed by the Supreme Court, the Cour de Cassation in France, in July this year. So despite their limits, the results of these measures were quite unexpected, as France has known during that period a historical decrease in its prison population. I've put another graph here, which corresponds to the evolution of the prison population throughout the year, and you can see that after March there was a huge drop in prison population, with over 30,000 less inmates at the end of May compared to beginning of March. There are several explanations to that. The early release measures taken by the government, which I've mentioned, but they account for only half, maybe 6,000 of these figures. And the other explanations, as Matt described, corresponds to the decrease in the number of incarcerations due to reduction of court activities during that period, and the decrease in crime during the lockdown period. This reduction of prison population in France triggered huge hope among professions and civil society organizations, because basically what appeared before as a problem that had no solution, overcrowding in French prisons, suddenly appeared to be solvable within a few months. And this was accepted very easily by the general public. There was the release of several thousand prisoners with no increase in crime and no protest no debate in the public. And obviously in the prisons, the conditions for inmates were improved, and environment for staff, working environment for staff was improved as well. So even staff unions spoke out in favor of this situation when they are generally more on a repressive stand. So this generated a consensus that this was a unique and historical opportunity not to renew with the situation of prison overcrowding in France. And on the 3rd of June, 1,000 persons representing all stakeholders in the justice sector, but also general public figures, sent an open letter to the president asking him not to miss this occasion and to take measures not to renew with prison overcrowding. Among the signatories of this open letter to the president was a lawyer named Éric Dupond-Moretti, who happened to become the justice minister only a few weeks later in July. So obviously the hope then was very important. Yet I have to say that after a few months, what we have now is a kind of disenchantment. There has been no short or long-term measures taken by the government to reduce imprisonment. So we feel that this historical opportunity has not been seized, and the result of that is that there have been an increase in the prison population, with 3,000 more inmates now than at the beginning of July. And I've put the figure here regarding the propagation of the virus in French prisons at the moment. So we have 80 clusters identified by the health authorities in the French prisons. That's all for me. Thank you very much.
Thank you, Cecile, and thank you for jumping in impromptu like that. I think it's really interesting to hear from the French experience. And one thing that, amongst many, caught my ear was when you said that the prison staff union seemed to come out in support of the idea of lowering the prison population. I think that it might well be something that our audience want to pick up on later, because I think that's quite a different experience and really very interesting. Thank you so much, and thank you so much for keeping to time. So we will come back to a lot of the points that you raised. The Q&A is busy. Please put questions and comments in the Q&A. We are filtering them, we are looking at them, and we will be picking them up and coming back to them at the end of the presentations. So everyone hopefully knows what's coming now. It is with huge pleasure and not a little anticipation that I invite Emma Jardine to present her information from Scotland. Emma is policy manager at Howard League, and we really look forward to this, Emma. Thank you so much, and over to you.
Now, can you see it this time? Tell me you can see it this time, people.
I think, Emma.
Yes?
Technical wizardry backstage is going to mean that magically, if you keep talking, we should.
This is supposed to be take two. This is supposed to be
I know.
the original.
I think, hey, ta-da!
Now, can everybody see?
Yes.
Right, we're there, thank goodness. No more apologies, let's just jump to it, okay? So, on the first slide, please, technical team. We're on the starting blocks, and in Scotland, the pre-COVID figure was 8,000 people in 15 prisons. The prison population had been decreasing from 2010. This is all going to sound like you've heard it all before, but it started to rise sharply again from 2017. This is all down to males in the population, not women and not young offenders. Young offenders have dropped significantly over the period. Scotland, sadly, has one of the highest prison population rates in Europe at 135 people per 100,000 of population. It's crowded, there's significant amounts of doubling up, and the Council of Europe's Anti-Torture Committee has highlighted on a number of occasions that there are human rights issues related to that overcrowding. There are poor conditions in quite a lot of the estate, and it's been singled out that there has been an inappropriate approach to women offenders, which we'll touch on later. This is the correct slide, thank you. We went into lockdown in Scotland on the 23rd of March. All visits were suspended, and on the 24th of March, the Cabinet Secretary for Justice announced that alternative methods of maintaining family contact would be introduced. And importantly, the day after the prison visits were suspended, he announced that he would not rule out an emergency release of prisoners. This is something that's never happened in Scotland before. All court business was suspended, as it was everywhere else, and as you can see from this graph, the prison population immediately started to fall. The prison regime restrictions were severe, as you might expect: no communal dining, suspension of non-essential work, no recreation, very little time out of cells. That was compensated for, compensation in its widest possible meaning, by the rising of prison wages for work that couldn't be done. You didn't have to pay for your television, and you got more phone credit. We highlighted that with that and the passing of the coronavirus legislation, which included for the release of prisoners, there was a huge amount of discretion afforded to prison governors. And that made it very difficult for us to keep an eye on what was going on. The first emergency release took place on the bill was passed on the 1st of April. And people started to be released on the 4th of May. That was done in such a way as to be described as a triple lock. So the first lock was only prisoners serving a sentence of 18 months or less, and within 90 days of their ordinary release were considered. The second part of the lock was, as has been discussed in other jurisdictions, many categories of prisoners were excluded. That excluded untried prisoners, those sentenced for various terrorist and sexual and violent offences. Importantly, the legislation made no mention at all of children or those particularly vulnerable groups. So unlike what happened in England and Wales, there was no specific mention of pregnant women, for example, or the very elderly. The third part of the triple lock was that prison governors could veto the release of prisoners on the basis of the fact that they may pose an immediate risk of harm to an identified person or persons. However, important to note that we would never know what the reasons for that were, and then therefore there was no oversight. Just before the emergency release started, the presumption against releasing people on tag was removed. We hoped that that would increase the numbers on tag and therefore help to reduce the prison population, but that didn't really happen. To give the government their due, they put a lot of time and effort into ensuring that people weren't released into homelessness, for example. So they worked really closely. Can we go on to the next slide, Richard, please? And they worked really closely. No, back one, please. So we're still on this slide. People started to be released in tranches from the 4th of May. There were 445 people identified as being eligible for release. Of those 445 people, 348 were released and 63 people had been identified for release, but their release was vetoed. And of the 348 people who were released early, 314 were men and 34 were women. And as I said before, unfortunately and importantly, no children. This took us to a position on the 29th of May where the prison population was at its lowest for at least 10 years at 6,869. That's a drop of 12%. We have had prison inspections going in since then from the 1st of May, but the data isn't complete, so it's quite difficult to see what's happening in terms of human rights. From what we have seen in some of the liaison reports, there's some odd language going on, but you might describe it as tensions between regime restrictions and human rights obligations, which we know are access to fresh air for 1 hour a day and access to meaningful human contact of 2 hours a day. The prison rules have been relaxed a little, but legislation remains in place until March of 2021. Things are pretty strange. And in the midst of what is now the second wave of the pandemic, the numbers of infections are much more serious than they were in the first wave. You can see here that the prison population has been steadily increasing again from that drop in May. As in England and Wales, jury trials have recommenced, so the fall in the population was down to no court business, not because of the 348 people who were released. Importantly, the Cabinet Secretary has announced that if necessary, there will be a second emergency release. We're calling for that, obviously, and we're already back to 122% occupancy in some prisons. We're calling for that additional emergency release now, and we want that to be based on a vulnerability model. On the next slide, please, Richard, we can see, similarly to England and Wales, the remand population has increased by about 52%, which is very, very worrying indeed. If we go on to the next slide, I think it's also helpful to look at what's been going on in the background, which doesn't get quite so much attention. COVID becomes the only thing that we think about. And in fact, there are other things going on, other news, if you like. I don't have the figures for this, but without substantial investment, we now know it's going to take 8 to 10 years to clear the court backlog, and 5+ years to clear the backlog of offender behaviour programmes, which means, similarly to England and Wales, there's a bottleneck in terms of those people that we're able to release from prison to support parole applications. Despite our unnecessarily high prison population, we have been trying to better utilise community-based sentences, alternatives. However, we now have over 750,000 outstanding hours of unpaid work under community payback orders. So that's been going on behind the scenes. There's been calls for that to be reduced, but we haven't seen any movement there. We have a commitment to gender-based management of offenders. However, the community custody units that had been promised, they've been put back during the pandemic, so that will slow things down. And importantly, there's a Scottish election in May of next year, so any decisions taken or commitments announced are much more likely to take into account the political context of what's going on, and therefore we might imagine that decisions become very short term or so long term as to be not relevant. If we go on to the last slide, I think it's pretty tempting to think that the overall health approach that we took at the beginning has been taken incredibly literally in prisons, and we're already slipping back to where we were. As you can see, we're already back to almost the same level of population as before. We're at 94% of pre-pandemic levels, and the sorts of phrases that we used to use at the beginning about nobody gets left behind and forgotten about feels rather hollow, I think. And we're introducing questions back into the rhetoric about how much money has it cost to give prisoners mobile phones, for example. So I think, sadly, we're now concentrating on the things that we concentrated on before, which weren't prisoners. And in a way, sadly, in summary, we're back to where we started.
Emma, thank you. There was vague optimism at points, I think, all the way through. People have been kind of going, oh, thank you so much for that. And the Q&A is full. So we have an interesting circumstance now. We have 24 unanswered questions and comments, and we have 14 minutes. Alessio is going to speak for 10 of them. My idea is therefore to very quickly run through for all panelists some of the outstanding comments and questions, so that you get 10 minutes while Alessio is presenting to think about answers. I'm going to take a huge liberty, and this is not to be rude to Alessio, but it is to suggest that if panelists have answers, please start putting them in the Q&A function or the chat function, and we can copy and paste. We have questions from Mariana Keisler about consistency across the estate, particularly with reference to male and female establishments. There's Barry's question about the proportion of women that have or haven't been released or not sentenced. We've got questions about which are the human rights violations. I think Emma touched on that, and Cecile perhaps. We have questions about sources for confirmed cases, numbers of people dying or tested positive in prison. We still have Eva's question about Skype and court and family access for pre-sentence detainees. Lots of people commenting on the missed opportunity, and Sunita Stewart-Toft is asking Cecile, why did that opportunity get missed? Was COVID a distraction? Gwyneth Boswell is asking, did President Macron respond to the open letter? And Oliver Lodge wants to know, if Cecile, there was no increase in crime, was it due to recall, the increase in prison population? How did that happen? Kirsten wants a reference from Emma, if possible, for up-to-date stats on Scottish prison numbers of people dying and tested positive. There's a question about transgender prisoner health and treatment and housing, if that's been affected by COVID. There's a question about particular impact on Black and minoritised community members testing positive as a result of COVID in prisons. There's a question about comparative deaths in custody. Is it being measured? Do we know what the differences are? Oh, we're finishing at 11. I was in a panic. This is still, I'm running through these questions because people might want to pick up on some of them for the Q&A at the end. Mental health, any particular insights, perspectives, understandings of the impact of COVID and presumably for lots of people, isolation? What is the role of the inspectorates and the Prison Officers Union in your jurisdiction? Are people in prison going to be prioritised for vaccines? And what is the particular impact on young people that you think is occurring where you are? So, great, I can relax a little bit while I take pleasure in introducing our final speaker, Alessio Scandura, who's been patiently waiting. Thank you so much, Alessio. Alessio is the coordinator of the Antigone Observatory in Prison Conditions and a long-standing colleague of the Centre for Crime and Justice Studies. So Alessio, you have what will hopefully feel like a leisurely 10 minutes. Thank you very much.
Thank you. I'll try to keep it short and possibly to answer also some of the questions that participants posted on the Q&A. But first of all, I'd like to present the situation in Italy in respect of prison population trends. This is the situation in February, at the end of February 2020. We had 61,230 prisoners, which this was after a period of increase of the prison population, although we were far away from the highest numbers recorded in Italy, that it was in 69,000 prisoners in 2013. But that was the situation. At that moment, we had an occupancy rate of 120.2%. Pre-trial detention rate was 31%, and foreign nationals among prisoners were 32.5%. We will come back on these numbers. On the 17th of March, so after the pandemic hit the Italian penitentiary system, after the riots, after it was clear that the situation was getting very, very serious, the government introduced the first measure, the first new legal provisions to reduce prison population in Italy. These were temporary provisions supposed to last until June 2020. They included home detention for detainees serving less than 18 months, and the possibility for detainees in semi-detention, so these were people that were only sleeping in prison but spending a day outside prisons, around 900 people in all, not to come back to prison, to have a leave until the end of June. The interesting point is that before the adoption of these measures, or I have the data on the 19th of March, prison population already decreased of 1,800 prisoners. So using the available legal provisions and the available measures, you already could register a significant decrease in prison population. After the adoption of these measures, as you can see, this decrease becomes more significant. So in these first 45 days, we have a decrease of prison population of more than 6,000 prisoners. half of that can be accounted to the new provisions. The rest of it depends on the access to alternatives to detention that were previously in force and that have been used more because of the pandemic. The decrease in the crime rate, situation similar to other countries. But on the 17th, a press campaign started by a weekly magazine and then taken on by the biggest national newspaper is launched to complain because in these 6,000 released prisoners, apparently there were dangerous mafia bosses. Later investigation proved that this wasn't really the case. And anyway, these people weren't released. The measure implied on detention with electronic monitoring, so they weren't released. They weren't free. But nevertheless, as you can see, in the following 45 days, the prison population kept decreasing, but with a very, the pace slows down. The trend, in the next 14 days, you have only 1,600 prisoners released. From the beginning, the overall decrease of the prison population is 12.8%. Occupancy rate decreases to 105%. As you can see, pre-trial detention and the percentage of foreign national doesn't change that much. Here you have a picture of these different groups, how the decrease in prison population affected these different groups. The decrease of women was much more significant than the average decrease of the total population. As you can see, foreign national and pre-trial detainees were affected less. This, in my opinion, this is a very significant point. There was no provision target to people in pre-trial detention, but nevertheless, you have a significant decrease on people in pre-trial detention, although not as much as the average of prison population. The point is that in our experience, when prison population decrease in Italy, because there is a general perception that, or because there is a change in the attitude of all the parties involved in criminal proceedings, etc. Usually, foreign national people in pre-trial detention decrease more than the average because at the end of the day, the use of prison as a measure of last resort means that in prison you have more serious offenders, you have longer sentences, you have less people with short sentences or pre-trial detention. And in our case, as in many other, among these people, foreign nationals are highly represented. So I would say that an healthy decrease in prison population would affect more foreign nationals and people in pre-trial detention. In this case, the decrease was led by legal provision that in fact affected less foreign nationals and prison in pre-trial detention. So in this respect, it's an interesting case, but the outcome, besides the numbers that we still are above our above the capacity of the penitentiary system, but besides that, the outcome is not optimal also in terms of the fact that you still have plenty of people that committed petty offenses, plenty of people in the trial detention that probably shouldn't be there in a moment like this one. At the end of October 2020, the government, as I said, the measure I mentioned were supposed to last until the end of June. In October 2020, the government introduces again these measures. But in the meanwhile, there has been an increase of prison population during the summer of 1,400 prisoners, and the effect of this this new measure, which are more or less the same as the old ones, as you can see, is so far has been very limited. In 1 month, only 500 people decreased. So probably we are in a situation in which the scope of these measures, the potential of these measures has been more or less exhausted, and we need, if we want to decrease further the prison population, at least to reach the legal capacity of the penitentiary system, we need to introduce new measures for the near future. The situation at the moment is that we have around 800 prisoners. That's a positive at the moment. That is comparable to the general population of the country. The situation in prison is slightly worse than the general situation of the country, but it's still frightening what could happen in the near future. So we still feel that there is scope to reduce prison population, possibly addressing different target groups than the one addressed by the initial measures. And that is all on my part. Thank you.
Alessio, thank you so much. We have lots and lots and lots of activity on the Q&A. So I know you've all got a load of questions that you're all thinking about answering and asking anyway, and I can see that kindly some of you are starting to answer questions through the function to and of each other. Thank you very much. So, Alessio, sorry, I am distracted because I'm doing more things than I should be at one time. Apologies. If I may, I'm going to open this up now and start asking for responses to questions that we've had previously and the most recent stuff that's come in. There's lots and lots and lots of questions and comments about mental health in particular. So, Alessio, I don't know if you want to start by thinking about any of the questions that have already been posed, or any particular areas you want to go into more detail on? Well,
I think that at the moment we need to focus on the main crisis, on the main emergencies we have in the prison system, and so to some extent answering to the question to what rights has been violated so far, I'd like to say two things. The first one regards the lack of transparency. So to some extent, at the moment, it's very difficult to answer that question, because at the moment, it's very difficult to know what's happening in prisons. The amount of information we receive is decreased enormously because we have less access, and many of our contacts have less access. So there is a serious lack of information. And also the information we receive tend to be led by panic very often. I'm thinking about families, relatives, prisoners themselves. They ask about news that many cases prove to be untrue. So there is a lot of panic in prison at the moment, and this makes it very difficult to understand what's happening with different groups on different issues, and what might be the consequence. What can be the consequence of the pandemic? A general perception we have is that there is a big issue at the moment with healthcare in general. That means not only COVID-19, and because of the lockdown of due to COVID-19, prisoners had access to much less opportunities for healthcare, less opportunities for less access to treatment, less access to test in external facilities, etc. So I think at the moment this is a very serious issue that regards also inmates with mental illnesses. Obviously, the impact of them probably has been very, very severe, but really it's very difficult to know because I mean, prison usually aren't the most transparent corner of our societies, but at the moment we're in the dark.
Thank you, Alessio. And I think, Matt, I know you've got a question that you want to come back and answer. I'll come to you in a moment if I may, but just following on from Alessio's point about the lack of transparency and openness around prisons generally, there's a question from, I think, Tara Nath about independent scrutiny and the role of independent scrutiny during the pandemic. And I know you're all nodding your heads. I think that's a particularly pertinent question. So I wonder if you each want to briefly comment on that.
But if I may, our national preventive mechanism kept visiting prisons during the pandemic to a limited extent, to a very limited extent, but it became basically the main source of information for the press, for the general public. It was the only one releasing data. The Minister of Justice wasn't releasing data for a long while. Now they started, but I mean it's a small office, and part of the staff of that office didn't want to go because they were scared of the risks for them and for the inmates. But basically most of the other institutions that take part in creating transparency. In Italy, the press as well has an important role. Traditionally, the press has quite easy access to prisons in Italy. And this is lacking at the moment, and it's a big concern as well. So very limited. It's there, but it's very limited.
Cecile, I know you were going to say something, and then maybe Emma.
Yes, in France, during the first wave, there was a total lockdown of prisons, and the national mechanism stopped the visits. So it was very difficult to have information about what's going on in prisons. We at OEPA received lots of phone calls and emails from prisoners and families trying to get some information. I have to say that the prison services were more transparent during that period with us than they usually are. They were aware that we were providing information to families and inmates, and that it was important to provide us with information for them. So when we were asking for information, we were getting the answer most of the time. The second wave is very different because the National Prevention Mechanism has continued its visits, and family visits have been maintained.
In Scotland, Her Majesty's Inspectorate of Prison for Scotland went back in on the 1st of May with what they call liaison visits. So these are short scrutiny visits. What they check on is informed by a framework, but the information that's provided to fulfill the framework in the matrix, which decides which issues rise to the top, is provided by the Scottish Prison Service itself. So if you like, they are marking their own homework. So that's been really difficult for us because we've not had sight of that. So for example, and I can see that coming through on the Q&A in terms of numbers of self-harm incidents and so on, that is recorded as part of the framework and therefore helps to know which prisons should be visited by inspectors as part of the liaison visits. But because we can't see that, we don't know what's going on. And one of the comments that Eliseo made about the media, it's clear that some of the information is being fed to the media, and we're very uncomfortable with the idea that we hear about serious potential suicide attempts, for example, being recorded in the media and nowhere else, and also of deaths. We don't know how quickly deaths are reported on the SPS website. It's very unclear what the rules are. They have a statutory obligation to state that there has been a death in custody and thereafter to have a fatal accident inquiry, but the timescales of that are not well set out. So we hear from friends and family and lawyers and so on of a death in custody, but if we don't see it reported on the website, we don't know if it's happened or not, and we don't even have official figures in terms of number of COVID-related deaths. That isn't reported at all, and the only reason we know that 5 people have died is because it came out in an evidence session in Parliament. So, you know, exactly as Eliseo said, in fact, I think, Eliseo, you were being very fair with your language. Lack of transparency, darkness is what we see.
Thank you. There was a question from Phil Taylor about the unions, and a very specific question about if there is evidence that in England and Wales, Phil, I hope I'm getting this right, that is there evidence that in England and Wales, the POA have been campaigning, I think was Phil's words, against early release, and how does this compare to the other countries or jurisdictions?
Shall I come in on that first and then pass over? Yeah, so initially the unions, the PGA and the POA, were quite supportive of the idea that you know there should be far more prisoners released. I think the PHA, Public Health England, briefing paper that was released in early April advised that there would need 15,000, the prison populations reduced by 15,000 in order to ensure single cell occupancy, so the best form of kind of like social distancing for prisoners. And the unions seem broadly supportive of that. As far as I know, there hasn't been, but other people in the chat who are more familiar with the work of them might what's going on behind the scenes might have a better idea.
Cecile, is that you wanting to come in on that? Okay.
Now, we're certainly aware of that in Scotland, but we haven't heard anything particular from the unions here. Some of the troubling narratives, I think, that are coming out, particularly in England and Wales, are to do with the fact that prison officers are supportive of regime restrictions remaining as they are because it has lowered incidences of prisoner on prisoner violence and prisoner on prison officer violence. And, you know, we need to be so careful about these types of narratives. What's the payoff for that feeds back into the severe mental health damage that we might be doing here and might have implications for years to come. My personal opinion is I think the unions have been a little bit disingenuous there. This is not to do with making their lives easier. This is to do with saving lives and protecting the health of all, themselves included, and their families. So this includes prison officers. So yeah, I would give them a little bit of a slap on the wrist, I think.
Can I jump in as well to say that's similar in England and Wales. They are supportive again of the restrictive regimes for exactly the same reason. So in terms of releases, but yeah, the regimes they are, and that is worrying.
Thank you. I know, Cecile, we have a lot of questions specifically for you, one of which was, did President Macron ever respond directly to the open letter?
No, we didn't.
Thank you. And there's a kind of collection of questions about family relationships, contact and access. I know, Cecile, you've said that family visits have kept running during.
Not during the first wave, but it started again in June and hasn't stopped since.
Okay, thank you. So there's a kind of collection of questions that I wonder if you could think about and respond to, maybe different aspects. Has technology been kind of kick-started? Has there been an advance in what might have otherwise taken a longer time as a result of COVID? Is that a wholly positive development? Are you seeing the benefits with no downsides? And how has the impact on family contact affected both people in prison and family members? Emma, are you ready and happy to answer some of that?
Yes, the day after lockdown measures were introduced, as I said in my presentation, Cabinet Secretary said that he would introduce increased measures of family contact. But that was from the 23rd of March. It took until the middle of June before the first mobile phones were put into prisons, and in fact the rollout was so slow that it took until August for it to be rolled out across the estate. And as a reminder, we're only talking about 15 prisons here. Virtual visits started before that. The most up-to-date figures that we have actually only go to August, and they suggest that there have been 4,000 virtual visits. But that's across approximately 7,000 prisoners, you know, so my math's not good, but I know that that's less than one per prisoner. And from what we hear anecdotally, the virtual visits are not quite as positive as everyone seems, and we've got to be so careful that we don't forget about the issues of digital poverty. So, you know, it's all very well for these things to be available, but if they're not accessible, and if the monetary value of them makes them out of reach for some people, then, you know, we're completely starting in the wrong place.
Thank you. Matt, do you want to add anything?
Yeah, I can add some about social visits. So they were in England and Wales. They were suspended in March when the lockdown came into force, and they were pretty much up until the restrictions began to be eased, which was something like August and September. And then in England and Wales, we went into a national lockdown again in early November, and they were resuspended. They did in that time they distributed 900 secure handsets across prisons. They said that there was already 60% of prisons had in-cell telephony, and they're just trying to extend that. And I know there was each prisoner was had one video call a month. And also, but when they allowed social visits again, there was a very low uptake because of the increase, because they still had to do it under restrictions. So I don't know how many would have actually occurred in that period. So yeah.
Thank you. Alessio, is there anything you want to add from Italy on that?
Well, what I can say is that immediately we introduced not only the possibility to virtual meetings, but also the legislation, the administrative legislation increased the number of phone calls that every prisoner could have. And that kicked almost immediately with the telephone, more slowly with other technology. But again, there is this issue of the lack of information. I want to make one example. So we visit prisons regularly, not during the pandemic, but regularly in the past, and we are not allowed to go unannounced. So we have to, and so we send an email, we make a phone call. There are some prisons in the country where you can, where the telephone doesn't work. That was, before the pandemic. They don't have connection because of the weather. There are islands, there are new facilities that weren't properly connected with the network, with the data network of the penitentiary administration. So on the one hand, you hear we have 190 prisons in the country. So you need so many stories of, moderate success in terms of keeping contact with family. But we have to remember that, there are different situations from one another, and some of them are very isolated. The technological infrastructure is very, very poor. And also because of that, we have no idea at all what's going on there at the moment. So, the situation, the problem was addressed, I would say successfully in some respect, but that regards the more well-known cases, not the others.
Thank you, Alessio. There is another collection of questions that I guess I would kind of frame as being around people with what in the UK we would know as protected characteristics, for want of a better description. So there's the outstanding question about women, which I know Matt has probably answered 8 times now because I keep asking it. But I wonder if there's any relevance in each jurisdiction about how this impact has been experienced differently by women, either through judicial process, through sentencing, or through release and early release schemes. There's a question about foreign national detainees in particular, and how people of interest to the Home Office have been dealt with and processed. And, yesterday we saw yet another plane of 12 deported men fly to Jamaica from the UK. So I don't know what impact COVID restrictions are having on your foreign national prisoner population. And there's this outstanding question around, has COVID-19 has any particular or specific impact that you're aware of on transgender people in prison? So there's a kind of little group of 3 areas. We also had a question earlier about Black people, people from minoritized communities, and whether COVID-19 is of specific relevance, either in terms of positive tests or vulnerabilities. So, Emma, do you want to say anything about any of that?
I think the answer to that is probably we just don't have the data, or rather, the theme here is not that we don't have the data, it might exist, but it's not shared. So I don't have any information on Black, Asian, minority, ethnic, unfortunately. We have a small number of transgender prisoners, and I don't believe data is collected on that in terms of COVID-related effects. On women, I think the important point to make is we really need to look at women prisoners through the prism of the fact that they are parents, and therefore need to take into account the effects this has on children. So we're starting to think about the human rights implications for the children of having mothers in prison, as Matt talked about before. Often we're talking about women on very short sentences anyway, and it seems particularly unreasonable that we haven't looked at things through on the basis of a vulnerability model of those who have caring responsibilities for children. That's an area that we haven't looked at, and we should have. And pregnant women, again, that's not been part of the story.
Thank you. Cecile?
Yes, so in France we don't have any figures or statistics as regards what proportion of the persons who've been released concern women, or so I can't unfortunately give you any details about that. We don't have any statistics regarding minority groups. It's forbidden in France, so we only have statistics about the foreign population. What I can say, however, is that the early release measures only concerned person who had accommodation facilities upon their release. Foreigners and homeless people most of the time were less concerned by these measures. This is one thing that we demanded. We demanded to the government that measures be taken so that persons who could have benefited from these measures but had no housing possibilities be provided with an accommodation by the government. But this hasn't been done. So a lot of persons who had maybe less than 2 months to serve still remained in prison because they had no solution outside.
Thank you. I am very conscious we've got 5 minutes left to answer questions. So I'm going to ask you to think about, should people in prison and prison staff be prioritised for vaccination? If there is not an evidenced increase in crime, particularly to you, Cecile, but I guess for the others, if there is not an increase in criminal activity, why are prison populations increasing? And is that specifically due to recalls and some jurisprudence issue further back the line? And there is a cluster of questions around what seems to be an expansion of the criminal legal system, and people seem to have some quite strong feelings about that. So if I may take chair's prerogative and ask you to focus your final answers, each of you, and I'll come to you in turn. I'll go Matt, Cecile, Emma, Alessio. You have the choice of those 3 questions. You can answer all 3 or you can choose one. And you've got about a whole minute each, so enjoy. Matt.
Thanks, Charlie. Yeah, so on the question of should prison staff and prisoners be prioritised, I mean, yeah, absolutely. I mean, the people who are being prioritised first, I think, are people in care homes and NHS staff, because obviously those are high-risk environments with people who are at greater risk of developing severe symptoms, much as prisons are. So there's an analysis by the Field Trust which showed that there are much higher rates of COVID-19 in prisons. Because obviously the type of environment just means that kind of like, it's a hotbed of, contagion. And so if, they're not going to take people out of the high risk environment, then they need to be prioritised for vaccination. And also because those environments are epidemiological pumps, which can increase the transmission in the community. So it would be protective as well for people in the community if they were prioritised. So the second one about why the prison population will go up. So in England and Wales, so this is kind of pre-COVID anyway, we have an administration which was committed to increasing the size of the criminal justice system, more police officers, more investment in prisons, building more capacity. So it's to do with the political administration in charge at the moment. And I didn't get the last question, sorry, Charlie.
That's fine. I'm going to leave it hanging and move on swiftly to Cecile. Thank you.
Yes, so as regards the increase in the prison population that we've known in the past few months, the explanation is not so much the backlog, but rather than magistrates are sending people to prison again, and it looks like they haven't learned from previous experience. We have a huge proportion in France of persons incarcerated for very petty offences. Over 50% of the prison population are people serving less than two years prison. So for me, it clearly shows that the incentive measures that have been taken by the government in previous years are not sufficient, and that compelling measures should be taken to make sure that people are not sent to prison when they shouldn't be sent to prison. And this answers also the questions why this opportunity was not taken by the government, because it would have needed very strong measures, and this of course hasn't been done.
Well, I feel another webinar coming on. Emma, I've made a mess of chairing. You don't any longer have a minute. You have approximately 35 seconds.
No problem. In terms of the question about lower levels of crime and rising prison populations, a lot of it in Scotland is down to sentence creep. So the length of sentences for the same crimes has crept up. The average has crept up over time. The programme waiting lists are going to make a big difference in terms of the numbers of people that we're able to release. We've introduced presumption against short-term sentences legislation for those under 12 months, but that affects the churn rather than the overall prison population. We know that community sentences are more effective and the government are good at articulating that message, but it isn't following through.
Thank you. Alessio, bad news for you. You've got even less than that.
Well, I would say only one thing. I think in my country, in my jurisdiction, but I don't think it's the case only of Italy, but in my jurisdiction, since Second World War, for sure, there never has been any correlation between crime rate and prison population rate. No, crime has been decreased since the 70s, for instance. Crime has been always decreasing. Since the 70s, prison population has been always increasing, except for amnesties or exceptional measures. So there's no correlation.
And I think that really is an interesting introduction to another whole webinar. Thank you so much. So we have approximately 20 seconds for me to give my grazie, merci, grazie, thank you to everyone, particularly our colleagues who speak a second language so technically and to such a level that makes it very easy for all of us to just sit back and enjoy. Thank you for your huge knowledge and expertise. Thank you to our massively international audience who have been so engaged and helpful to us and each other. Check out the Q&A. There will be follow-up. You will all get a very short survey. Please complete it. This is the first of 4 webinars. Please sign up to the next 3. The next one will be in January. This event has been free, brought to you by the Centre for Crime and Justice Studies. Please take a look at our website. And if you feel like making a donation, no one's going to be upset about that. And we look forward to seeing you at our next event. Thank you so much for your time and attention. Goodbye.